All right, we are getting into the final section of our course now, yoga and the double-edged sword. If there was one video in this entire course that I hope you watch and really pay attention to, it's this one. We've already talked about how yoga can be a game changer in eating disorder and how it can help all students cultivate skills for mindful eating, emotional resilience, and positive embodiment. But yoga can also do harm. Eating disorders are very, very serious illnesses, especially at that clinical level of intensity we talked about with anorexia, bulimia, and binge eating disorder. And one of the most relevant issues with eating disorders to yoga teachers is cardiovascular complications. It might surprise you to know that eating disorders, and anorexia specifically, have the highest mortality rate of any mental illness. And one of the big reasons for that is cardiovascular complications. Eating disorders take a toll on all systems of the body, from the kidneys to the liver, to the skin, and to the muscle system. But part of that muscle system, believe it or not, is the heart. Starvation and purging in particular, and binging purging as well, can do a lot of damage to the heart. And these issues that happen in people with eating disorders are relevant to you as yoga teachers because someone may be walking into your class that has an unseen injury, if you will, an injury of the heart. I want to go through a few cardiovascular complications that are common in eating disorders, but before I start with those, I want to dispel a big myth, and that's that cardiovascular complications only occur in people who are underweight. Cardiovascular complications occur in people who are both underweight and at a healthy weight, as well as people who are above a healthy weight, at least as defined by the BMI scale. I actually had a student a few years ago who died on her yoga mat, and she was above a healthy weight. And the reason for that is the first cardiovascular complication we're going to talk about, which is electrolyte imbalances. So restricting the food intake, so starving or even just cutting calories significantly, as well as purging. And purging can come in the form of vomiting or overexercising. Both of those things can cause electrolyte levels in the blood to be off balance. And you might be listening to that and going, what does that have to do with the heart? Why do electrolytes have anything to do with the heart? Your heart is an organ that relies on electrolytes to keep pumping. So you might have heard of like electrical impulses in the heart. Your heart relies on a very fine balance of sodium, potassium, and magnesium to keep beating. And when you go on a severe diet, meaning you restrict your calories significantly, or you over-exercise, or you purge, vomit, use laxatives, you throw off that very fine balance of electrolytes in the blood. And that can cause sudden cardiac arrest. So again, for you as a yoga teacher, what that means is if you know that you have a student who's actively using laxatives, actively making themselves throw up, or severely restricting their food intake, that person may be at risk of having one of these complications happen in class. And again, eating disorders have the highest mortality rate for this reason. There's some studies that suggest that as much as 80% of people with eating disorders, with clinical eating disorders, have cardiovascular complications. So I want you to be really aware of that. And one thing I'll point out here about the electrolyte imbalances is that if you're teaching a class in a warm room, or you're teaching a particularly vigorous kind of class, that's a very high-risk type of yoga class for somebody who's engaging in purging or starving behaviors. Another thing I want to point out is a heart condition that's really common in anorexia and increasingly in bulimia as well, and that's a condition called mitral valve prolapse. I mentioned earlier that eating disorders can cause dysfunction in the muscular system. You might not think about it this way, but your heart is actually a muscle. And one of the strange things that happen when people restrict their food intake, and I say it's strange because it's like, why would the body do this? The body first burns fat, but as it burns more and more fat, it becomes metabolically inefficient to eat fat stores, and so the body will start burning muscle. And you might have heard, oh, I lost a lot of weight, but I seem to have lost muscle mass as well. It might surprise you to know that the body will actually start to eat at the heart muscle when people are severely restricting their food intake. So that can cause a condition called mitral valve prolapse, which basically means that the valves in the heart become weakened and the heart becomes less effective at pumping blood through the body. And so you can imagine that might put somebody at risk, of course, of cardiac arrest and all of the really serious ones, but also of fainting in class. Like when I was younger and I had my eating disorder, I fainted on a marching band field once, I fainted on a soccer field, and the reason for that is my heart was not as good at getting blood to my brain, and thus, I was more prone to fainting. Another few things that are really common in eating disorders when it comes to cardiovascular problems is bradycardia, which is a really, really slow heart rate, which you can imagine might be problematic if you're doing a vigorous class. And then another thing that happens is a loss of autonomic control. And we've already talked about, you remember, the autonomic nervous system. Without going too much into the science here, people with anorexia actually develop an overactive parasympathetic nervous system. And part of the reason for that is the body's trying to conserve energy. So it's not trying to use energy to move, it's trying to just conserve. And as a result of that, the sympathetic nervous system is less good at getting the body moving when it needs to move. And so the blood vessels are not as good at constricting and getting blood to the muscle. And again, this can put somebody at risk of fainting. It can give dizzy spells, all kinds of stuff. I'm going into this because I want you to have the information as a yoga teacher, and I want you to know how serious these things can be. People die all the time as a result of an eating disorder, and we'll talk about it later, but your first job as a yoga teacher is to keep the students in your class safe. If all of this feels really overwhelming, I want you to just sort of hold it within you for now and know that in future videos, we're going to go into what happens if somebody comes into your class and you're like, oh my gosh, she is clearly struggling with an eating disorder. What do I do? How do I have a conversation? Should I teach her? Should I let her be in the class? Should I not? We're going to go into all of that later. But for now, I want you to take some really good notes. Take a look at the reading that comes along with this class so you can educate yourself. And then we'll talk again later about how to help students you're concerned about.